Coming to the anatomy of the pancreas, first of all, we'll discuss the basics of the pancreas. A pancreas is basically a retroperitoneal structure. It is located behind the peritoneum. The pancreas forms the bed of the stomach. Now here we can see the stomach somewhat lies here, and then whenever we have anomaly called as pancreatic pseudocyst, that forms in the just behind the stomach. So we do the cystogastrostomy. In the cystogastrostomy, basically through the anterior wall of the stomach, we go into the stomach, then through the posterior wall of the stomach, we pierce the anterior wall of the pseudocyst and then enter into the pancreatic pseudocyst. In this way, we make a connection between the pseudocyst and the pancreas, and we do the cystogastrostomy in this way. This is important in order to understand. So the relationship of the pancreas with the stomach is important in order to understand the cystogastrostomy. Now going to the parts of the pancreas, we are having the uncinate process: head, neck, body and tail. Head is the 30% of the pancreas, and it lies in the curve of the duodenum in something this way. And here we have the bile duct, which opens in the second part of the duodenum, and here the bile duct receives the pancreatic duct. Now the body and the tail basically forms the 70% of the pancreas. The neck of the pancreas is somewhere here, and it lies anterior to the L2 vertebrae. And behind the neck of the pancreas, the superior mesenteric vein joins the splenic vein to form the portal vein that we'll see in the next diagram. And here also you can see that in between the neck and the uncinate process, two vessels are present, superior mesenteric artery and superior mesenteric vein. That also we'll see in the next diagram. One important thing which I have highlighted here by different colors is the uncinate process and some part of the head. This is formed by the ventral pancreatic bud, whereas the tail, body, neck and some part of the head, this is formed by the dorsal pancreatic bud. One important line you must remember is congenital anomalies of the pancreas is due to the abnormal rotation of the ventral pancreatic bud. Now going to the next diagram to understand the relationship of major vessels with the pancreas. Here in this diagram, this is the right, this is the left. We can see the IVC here, aorta here. Now first going into the aorta gives three unpaired branches which are celiac trunk, superior mesenteric artery and inferior mesenteric artery here. First of all, going to the celiac trunk. The celiac trunk gives three branches. One is left gastric artery, another is splenic artery, and then we are having the common hepatic artery. So the splenic artery goes along the superior border of the pancreas here. Then after down we are having the superior mesenteric artery. Now the tail of the pancreas is in very close relationship with the spleen. Through the spleen, we are having the splenic vein which receives the inferior mesenteric vein, and then the splenic vein goes near the neck of the pancreas where it unites with the superior mesenteric vein to form the portal vein. Now this happens in the neck of the pancreas. In the neck of the pancreas, superiorly we are having the portal vein. Anteriorly here lies the pylorus of the stomach. Below is the superior mesenteric vein. These are the relationship of the neck of the pancreas. Now the neck of the pancreas is a surgical danger zone because here there is the portal vein. Portal vein is a large, thin-walled and vessel which is very difficult to control even if it is injury is very small because it causes massive hemorrhage. So in this way we can understand how the neck of pancreas is related to the portal vein, and the surgeries like Whipple's procedure, if it is injured then it causes massive hemorrhage. Thank you.